Welcome to the Anemia Management Protocol Documentation video. This video will show you what and how to document in Renal Insight when using the Anemia Management Protocol. This video covers the following topics: the actions and responsibilities of the initial RN who's following the Anemia Management Protocol, the actions and responsibilities of the second RN who's following the Anemia Management Protocol. This is also known as doing a double check, and what to do if the patient requires repeat 2-week blood work. This slide provides an overview of the actions that are required of the initial nurse who is following the Anemia Management Protocol. The following slides will break these steps up into more detail and will be accompanied by a video clip. As the initial RN following the Anemia Management Protocol, you are responsible for confirming that the patient has an active anemia management order. In order to use the Anemia Management Protocol, you need to gather the necessary information, which includes reviewing the previous anemia management note template so you have an idea of what happened last time, reviewing the patient's medications and their recent blood work. With this information in hand, you can then follow the anemia management algorithm to determine your next steps. Once you know what you need to do, you need to document these decisions and make the necessary changes in Renal Insight. This includes entering a new anemia management note template and making sure to flag a nurse, making the required medication changes, and ordering the required lab tests. The first thing we want to do here is check to make sure that our patient has the anemia management frequently prescribed order on their file. Please note that we will be using test patients in this video, so some aspects of the patient's chart, such as dates, medications, and lab results, may not make complete sense. For the purpose of this video, we will only be focusing on the information that is related to anemia management. To check to see if our patient has the anemia management frequently prescribed order on their chart, we want to click on the patient's name and then click on orders. And then here we see the anemia management order, the prescriber, and the date that it was started. This confirms that our patient is on the anemia management protocol. It's important to review your patient's previous anemia management notes. Not only will this help you get a better picture of your patient, but it will also help you when using the anemia management protocol. So to do this, you want to click on your patient's name and then click on the music note icon up here to review their progress notes. Since our patient is a test patient, they haven't had any progress notes logged within the past 2 months. So I'll go ahead and change the period to all, and this will bring up any progress notes that are on the patient's file. For a real patient, there'd be reams of notes here. So to filter what you're looking for, you can select Anemia Panel from the Note Template drop-down menu. This will bring up all of the anemia management notes that we're looking for. So we can select the most recent anemia management note and hit Details for more information. So here we can see that there's not been an ARNS dose increase in the past 5 weeks. The ARNS dose was increased 40 micrograms weekly, and the TSAT was within target range. The iron dose was also not changed. So now we have an idea of what happened last time, and this will be helpful when we use the anemia management protocol. Next, we want to look at the patient's medications to see what they're currently on. To do this, you want to click on the patient's name and then click on the medications icon. In the medication list, we want to focus on the Aranesp and iron medications, as these are the two that we will be dosing. So we can see here that currently this patient is on a maintenance dose of iron. He gets 100 milligrams IV direct every 2 weeks. He also gets 40 micrograms of Aranesp once a week. When using the anemia management protocol, we need to know if the patient's Aranesp dose has been changed in the past 5 weeks. So we can check this by filtering out Aranesp. To do this, you want to click on the medication and then click on Specific and All, and this will show up all of the medication orders for this type of medication on the patient's file. So we can see here that their Aranesp dose has not been changed in the past 5 weeks. This is important to note for when we look at the anemia management protocol later. Now we want to do the same thing with iron. So we select Active and All to bring us back to his current medications. We'll highlight iron sucrose, click Specific and All, and now we can see the iron medication history. So there are a couple things we want to see here. One, we want to know if our patient has just finished an iron loading dose or if they're on a maintenance dose. And two, we want to know if they've had 2 iron loading doses in a row. This information is important to note for when we're looking at the anemia management protocol. So here we can see that our patient is currently on an iron maintenance dose, and they recently finished an iron loading dose. The next thing we want to do is review the patient's blood work. The easiest way to do this is to click on the patient's name and then click on the Windows icon here to view their panels. This is more efficient than going to lab results and sorting through a ton of information. So we'll go ahead and open the panels now. Here we can see the patient's panel summary, and we see here that it's blank. That's because we're sorting by personal, which is similar to our favorites. So what this means is that we haven't favorited any panels yet. So we can go ahead and add our anemia panel to this personal or favorites list so that it's more easily accessible next time. And to do that, we're going to select all and then click on the anemia panel, check off the box in the personal column, and then hit save. The next time we click on the patient and view their panels, the anemia panel will be here front and center, and we won't have to go digging around for it. To view the anemia panel, make sure the row is highlighted and then click Display. Rather than having to sort through all the other blood work results that we may not need to know right now, this panel gives us a quick snapshot of the information we need to know when we're using the anemia management protocol. We also get a little snapshot of the medications here, but this doesn't give us the level of detail that we need, so we can't rely on this page when gathering information about the patient's medications. So here we can see our current blood work and our last blood work. And this is the row that we're going to do our anemia management on, the current blood work. So as you can see here, the hemoglobin is 85, the TSAT is 18, and the ferritin is 330. Please note, we're not basing any decisions on ferritin except for if we see that it's greater than 1200, in which case we will have to contact the prescriber because that means the patient could have an active infection. But for dosing medications, we only need to look at the hemoglobin and the TSAT. Now that we have an idea of our blood work, we can move on to look at the algorithm. Here we are looking at the hemodialysis anemia management protocol. We are going to follow this protocol based on the lab results and medications of our patient that we just viewed in Renal Insight. So we know that our patient had a hemoglobin of 85, which means they fall under this category. So we will be using this pathway. Next, it asks if the patient is receiving ESA. After looking at our medications, we know that our patient is, so we'll say yes and follow down the right-hand side of the pathway. We can ignore the first part here, since our patient just had their blood work done. Now it says if the TSAT is less than 20%, consider an iron loading dose instead of increasing the ESA dose. We know that our patient had a TSAT of 18%, so that means we can just stop right here and move on to the next page. Now we can move down to the IV iron protocol on the next page. Again, since we know our TSAT is 18, which falls under the first category here of less than 20%, we will be using this pathway. The first step in this pathway tells us to start an IV iron loading dose. If the patient has never had IV iron before, consult the prescriber. But in our case, we know they have as we've seen their medication history. We also know that our patient is on iron sucrose, so we'll go ahead with 100 milligrams for a total of 10 doses. Please note that it says here not to administer more than 2 courses of iron loading doses in a row. We know that our patient had recently finished an iron loading dose, but they're currently on an iron maintenance dose, so we're fine to go ahead and start them on this iron loading dose. Moving further down the pathway, it says to measure their TSAT with their next routine blood work. Now that we know what to do, we can go back to Renal Insight to do a note template. So first you want to click on the patient's name and then click on the people icon up here to open up the encounter page. We'll select the anemia panel from the note template drop-down list. And please note, it's important that you put the encounter note in first prior to changing your meds, because when we open up the anemia panel note template, the medications that the patient are currently on get pre-populated in here. So if we had changed our medications first, then it would look like there was an iron loading dose already there. But it's not, and that's what we're going to add in today. So we're going to add some free text in this text box here, and you want to make sure that you document what you're doing and why you're doing it. The more detail you provide, the better. You want to provide as much information as you can for the next nurse who will be reading this note. So today we can note that we've started the patient on an iron loading dose for 10 doses, and we are maintaining their current Aranesp dose. The other thing we want to do here is to flag the nurse. This is important so that a second nurse can do their check. And now we just hit save. Now that we've already put in our anemia note template, we can go ahead and make our medication changes. So we'll open up the medications list, and I'll delete this allergies box. So we know that we're maintaining their Aranesp dose, so we won't have to make any changes here. And we know that we want to add an iron loading dose. But that means that we'll have 2 orders of iron here, and we want to make sure we don't have 2 active orders of the same thing on at the same time, as this causes some confusion when signing off on orders at the bedside. So first we are going to add an iron loading dose. So we'll type in the name of the medication in this bar here, iron sucrose, click new, and then we'll select the medication, hit select. And here we get a little warning box letting us know that there's already an active order for this medication. So we can click OK to continue. And then we'll fill in the medication order details here. The first thing you want to do when putting in a medication order is to select the prescriber. Since we're following the anemia management protocol, our prescriber is going to be protocol management. And then for communication, we're going to select per algorithm. Next, you want to put in the amount of doses, which in our case is 10, and the dosage, which in our case is 100 milligrams. Then you want to select the frequency. So because we're doing an iron loading dose, it's going to be 3 times weekly. And the way you're going to choose that is if you have a Monday, Wednesday, Friday patient, you'll select Monday, Wednesday, Friday. And same if you had a Tuesday, Thursday, Saturday patient, you would select that. And then you want to make sure that the timing is set to intradialysis. And finally, you want to acknowledge the order and then save the changes you made. So now that we've put in an order for an iron loading dose, when we look at the patient's medication list, we can see that we have 2 active orders for iron. So to fix this, we're going to open the medication order for the iron loading dose that we just put in. So we'll select that and click Details. And then we'll see that the end date listed here is February 9th. So they should have received all 10 of the doses by February 9th. So now we're going to look at our calendar to see the date that is 2 weeks from February 9th, which is February 23rd. And we want to know this because we know that the other iron order that we have, which gets administered once every 2 weeks, will start 2 weeks after the last iron loading dose is given. So now what we can do is we can exit out of that order and open our maintenance iron order. Click Details, and we'll change the start date to start 2 weeks after our last iron loading dose has been administered, which we know is going to be on February 23rd. And then we can click Save. Now when we look at the medication list, we can see that the iron loading dose is currently active, and then the iron maintenance dose starts 2 weeks after the last dose of the iron loading dose has been given. So now when you sign off on the iron medication on bedside, you'll be signing off on the correct one. If you recall, in the algorithm, it told us that for TSATs that are less than 20%, which includes ours, that was 18%, the last step we reviewed in the algorithm said to measure TSAT as per zone with your next routine blood work. So with that being said, we want to double check to make sure that for our patient, their TSAT is due to be measured with their next routine blood work. To do that, we want to make sure that our patient's name is highlighted and then click on the test tube and gavel icon up here to open up their lab orders. So now we want to double check and make sure that TSAT is due to be measured with the next routine blood work. So here we see that the next routine blood work is on May 2nd. So we can highlight that and click Explode. This will show us the list of everything that is due to be completed with this blood work. So we can see here that TSAT is actually not included in this list. So this should prompt you to go ahead and put in a lab order for TSAT to be done on the same day as this routine 6-week blood work. This practice varies among the different zones. Some zones include TSAT with their 6-week blood work and others don't. So it's best to come in here and double check to see if it is due the next routine blood work, and if not, to make sure you then add it in as per the protocol. If the next routine blood work happens to be both the 6-week and the 12-week routine blood work, then you don't actually have to add anything in there, because as you can see here, when we explode the 12-week routine blood work, you can see that TSAT is included in this list. So we don't have to add it in here. Now we'll walk through an example of what we would need to do as the second nurse who has been flagged. As the second nurse, when you log on, you'll see a flag here under Progress Note for the patient. So as a second nurse, you would click on that. And then you see that here where it says note template, it's an anemia panel note template. So this should prompt you to do your independent double check. It's important not to read the text that's written in the note template here, as this could cause some confirmation bias when you're doing your independent double check. So once you see what the note template is about, it should prompt you to go through the entire process as if you were the first nurse and you were using the anemia management protocol for this patient. This would include ensuring that the patient has been ordered the anemia management protocol, reviewing their previous anemia management notes, reviewing their medication history and recent blood work, and then taking that information and using the algorithm to decide on your next steps, and then determining whether or not those steps align with what the first nurse has written here. If you do come to the same decision or conclusion as the nurse and you agree with what they have in their note here and the medication changes they've input or the lab orders they put in, if you agree with all that, then you click on the pink acknowledge button here and save. If you've come to a different conclusion and disagree with what the first nurse has put in their note here, then what you would do is you would approach that first nurse and share your findings with them, provide some rationale as to why you disagree, and you would work with them to come to an agreement as to what the next steps should be. If you're unable to come to an agreement, then you need to contact the prescriber. If you are able to come to an agreement, as the second nurse, you are then responsible for putting in another anemia note template, essentially saying that you didn't agree with the first nurse and summarizing what the changes would be. You would then make sure that these changes are reflected in the medication order and the lab orders as well. Again, please remember to double check that the first nurse put in the medication orders correctly, especially the dosage. When using the anemia management protocol, there may be some cases where you're instructed to measure hemoglobin in 2 weeks' time, such as in the example here, if we had a hemoglobin that was greater than 115 and the patient was receiving Aranesp and their hemoglobin was actually equal to or greater than 126, then we're instructed to hold Aranesp and then measure hemoglobin in 2 weeks' time to reassess the Aranesp dose. In this case, you want to make sure that you note in the anemia note template that you put in that hemoglobin has to be measured in 2 weeks' time. That means in 2 weeks' time, when we get our blood test results back, then we have to come back to this protocol and use the algorithm once again to determine how we move forward with our Aranesp dose. To continue on with our example, we've just received our 2-week blood work results and our hemoglobin is still greater than 115, so we'll follow the algorithm here. Next, it asks if the patient is receiving Aranesp, and we can actually go down this third column here because their Aranesp was put on hold. And then depending on whether their hemoglobin levels fall between 116 to 125, we would follow down this set of arrows, or if it's greater than or equal to 126, we would follow this arrow. In this example here, where their hemoglobin is between 116 to 125, it then asks if the change is less than or equal to 10 grams per liter from the last hemoglobin, and if so, then we're instructed to continue to hold Aranesp and then measure hemoglobin again in 2 weeks' time to then reassess the Aranesp dose then. However, if the change is greater than 10 grams per liter from their last hemoglobin, then we're instructed to restart Aranesp at a reduced dose as per the ESA dosage adjustment table that's further down in this booklet. And similarly, if their hemoglobin is greater than or equal to 126, then we're instructed to continue to hold Aranesp and measure their hemoglobin again in 2 weeks' time, at which time we will reassess their Aranesp dose then. To recap what we just learned about the 2-week follow-up blood work that gets ordered, when that blood work is collected and the results have come in, the nurse then has to review the previous anemia management note template, which will show that blood work was reordered for 2 weeks' time. Then the nurse has to plot the current repeat blood work on the anemia management algorithm to determine whether to continue and hold Aranesp and repeat the blood work in another 2 weeks, or to restart Aranesp at a lower dose. The nurse is then responsible for putting in a new anemia management progress note detailing the actions they're going to take, and then of course flagging a nurse for an independent double check, and then making any necessary changes to the medications in Renal Insight. As a second nurse, you are required to do an independent double check, which